Welcome. This is Meet the Problem Solvers. It's a new show here on cable TV, Cambridge Community TV. And each week we will have a different guest, or in some cases we'll have a couple of different guests who are experts in their own field. My name is Judy Perlman and I will be hosting Meet the Problem Solvers. It's going to be a very exciting opportunity for me to get to learn a lot about a lot. And for people who come on this journey along with me, we'll be learning all kinds of things from some really fascinating people. The whole idea of this show is to figure out how we can learn something about a problem we didn't know very much about, what some of the solutions may look like, and really to bring it back to ourselves. What can we be doing differently in our own lives to feel better, to be better to our earth, to be better to our fellow citizens, whatever that turns out to be. So that being said, as the premise of the show, I'll just tell you a little bit about myself and sort of the evolution of this show. I've been working for 30 years in the nonprofit world and more recently as a consultant. And in the course of that work, which largely had to do with homelessness and other community issues, I came to understand that as important as the work can be within a project, sometimes the most valuable thing we could do is to pull the lessons up out of a project and share them, to disseminate the lessons learned, tell a story, importantly, have the people tell the story who have been unfurling and unrolling this narrative. So my hope is that we'll have a really exciting set of conversations along these lines. And here we are. This brings us to our very first expert. I would like to introduce you to Dr. Holly Herman. She has been a physical therapist for 44 years, and she's really a very eminent and important person in her field. She is certified in orthopedics, sexual medicine, biofeedback, urology, and pelvic rehabilitation. Pelvic rehabilitation has really been where much of her focus has been as a practitioner and as a teacher. And so I'm going to now throw it over to you, Holly. Articulate for us what it is that we're going to be talking about today.
Oh, such a pleasure to be here, really, for you to bring this to light and to give the issue that we're going to talk about tonight of bowel, bladder, and sexual function, issues in many people, to the forefront. So we have millions upon millions upon millions of people who are really struggling with bowel, bladder, and sexual function. And in many cases, pretty much the majority, they're never asked about it. They're never asked about their concerns, their anxiety, their worries, what might be, where they want to go, what their goals are. And so I have been really focusing on that issue for the last 40 of my 44 years.
Those are pretty embarrassing topics. I mean, it's hard to say to your friend, to your loved ones, probably even to your doctor. It doesn't go so well when I go to the bathroom. I have some challenges, I have some questions. So I can understand how it gets to that point.
Yes, the average for most women to really seek out some sort of help with that, issues of urinary incontinence, particularly after giving childbirth and having every system in your entire body changed, and having the little ones come out with having perhaps taken a souvenir of their trip by a bladder that falls down, or a uterus, or the rectum. And for guys too, as they go on with different issues in terms of erectile concerns, or porones, which is injury to the genitalia that involves a curve to their penile shaft, premature ejaculation. All of those things are so worrisome for people, and they have nobody to talk to about it. And then they think that if they do talk about it and get enough courage, they are oftentimes dismissed as not, what do you want? You want surgery? You want medications? And I'm here with this show and your insight to have brought this to light, that it can be helped by just strengthening up the muscles, and in many cases relaxing muscles, so that a better blood flow, better oxygen, more exchange of waste products in the muscles can make it so that things are going to work better.
So that's amazing. I mean, I can tell you that you have helped me in many ways as my longtime friend and also longtime physical therapist. It's been kind of amazing how you ask questions, you make a connection between something in my shoulder is really causing something in my hand. So this is what you bring forward, is your insight and your wisdom about this.
Yes.
And the other thing I would have to say is you also make it really easy to talk about difficult topics.
Well, when only 3% of the healthcare system asks people about their sexual concerns within the last 3 years, 3%, who's going to bring it up? The literature says that most people are worried that you, let's say you were the provider, that you would be embarrassed and that you wouldn't be able to handle it. So that's why I went and got certified in terms of being a sexual counselor. But in order to be able to make it so that my patients can feel comfortable when I ask them questions, and also to teach all other physical therapists that come my way that want to learn about it, that they can do something about it.
You know, that's something that I wanted to bring up, because physical therapy is often sort of one person in a room with another person, and it's very one-on-one, but you have made a really important part of your contribution is as a teacher, as an instructor and as a teacher. Can you talk us through that a little bit?
It's really quite amazing. The classes that we give, the physical therapists that come, or the healthcare practitioners that come, because sometimes they can be midwives, they can be PAs, they can be nurse practitioners, physicians themselves, that they're going to come, and we actually practice on one another. So if we're going to learn about urinary dysfunction or urinary problems and concerns, we actually have 8 labs throughout the 3 days that they come, that they practice on one another. How to evaluate the muscles, because the pelvic floor has 3 different layers, and it has 4 muscles in the first layer, 4 muscles in the second layer, 6 muscles in the third layer that go out to the belly, go out to the hips, go into the insides of the thighs. So any of those muscles could be contributing to somebody not being able to last through a movie for their continence, and or that they are really worried that during their sexual activity that they're going to have an accident. And that's a number 1 reason for decreased sexual satisfaction. For guys too, after they've had prostate surgery, they're very worried for something that's called climacturia, that they're going to have urine that's going to be leaking out. Same thing with bowel. People shut themselves up in their house. They don't go to church. They don't go to synagogue. They don't see their friends anymore. They're very, very worried and anxious. And who talks about their sexual activity? This millennium, this generation, they're starting to, which is really great. They're so gender identified and talking to one another and so open that now the conversation is good. But a lot of times they have no idea about their anatomy or about what can be done.
So, thank you so much. You've kind of laid out the problem really, really clearly. This is Meet the Problem Solvers. I'm Judy Perlman, and my guest is Dr. Holly Herman. So I asked you to tell us about the problem. The problem sounds pretty intense and very intense for the person who's undergoing it. Now let's turn to solutions. What can be done? How do you do it? And how do all the legions of people that you've been teaching, how do they not only help patients, but how do you and they spread the word even more widely?
Yeah. So the solution actually is with every one of you. every single person who has some concerns about either bowel, bladder, or sexual function, there is a place to go to talk about this. And once you've talked about it, then to figure out how your muscles, how your anatomy, what's going on in twists in your body, how you learned how to use your muscles or had some sort of change that made it happen throughout your life, how that impacted, plus aging. What goes on in terms of hormones and changes with childbirth and getting into our fourth, fifth, and sixth decades, so that we can really figure out how to make it so that you can function better. That's what physical therapy is all about. It's all about function. It's all about making it so that we address your goals, your ambitions, your thoughts, what you want to have happen, and making it so that it's possible. So many people think that they are alone. They are the only person who has these issues. So many people are worried to tell their partner. So many people don't know how to talk about it. So giving people a safe place, a safe environment, and also a dynamic environment in order to be able to change it and empower themselves is absolutely vital. So know that when you are going to go see your doctors, when you are going to go see your healthcare practitioners, if they do not ask you about your bowel, bladder, or sexual function, even if you're going to them for your foot, even if you're going to them for your wrist, even if you're going to them for headaches that you have, this should be discussed, and it should be so that you are going to be on a path to see somebody who can help you to take care of those things. People wait years. The average is 3 to 6 years for women to have urinary incontinence. I have patients here in Massachusetts and in Boston and Cambridge who are world-renowned experts in their field. Microbiology, chemistry, all different aspects of literature. And they are terrified to talk to anybody, and they are suffering alone. So it is time that they know that these aspects of their health and their wellness need to be discussed, that there are people who are trained to be able to help you figure out what's going on and set you on a program that can strengthen up your muscles, take away tenderness, take away pain with you as an integral part of the program, and to make it so that you can have a much better, active, less anxious, less worried life.
One of the things we were also talking about before the show was the need to get the word out, not just to patients to advocate for themselves, but really to talk with nurses and doctors and everyone else, to either to bring them in or even just to escalate their knowledge, to escalate their understanding about what these issues are, to make it easier for them to ask those questions, and for them to know what to do. One of the things that Holly has done in her teaching, she has, what did you say, 10,000 people have gone through some of the courses that she has designed and disseminated. So if somebody actually has a problem with bladder, bowel, or sexual function, it's a little hard to say, it's a mouthful. There are places that there are people that their doctor or their nurse can refer them.
Yes.
And so trying to sort of get the word out, and that's really what my hope is for this show. I'll stop waving my hands about it, but seriously, I think it's a great opportunity to help people understand what is possible that they may not have known was possible before.
There are at least 50 physical therapists just in this greater New England area that are really trained and are expert musculoskeletal people that can really help you discern what it is. You know, sometimes it's a painful hip that really causes some of the pelvic floor muscles that attach, that can cause difficulties in terms of, being able to run. And is it the pelvic floor muscles that caused the problem? Is it the hip muscles that caused the problem? What was it? But people oftentimes don't put those things together. So when they come to me and I do an evaluation, sometimes it's even their foot. that has an injury to it, and how they're landing on their foot sends different kinds of forces up to their pelvic floor and can make it so that they're not able to use those muscles, or that it's so jarring for them that they can't really overcome the forces that are established from that hurt foot. So there was somebody who came on in. She said to me, my pelvic floor is not working so well with Boo Boo, her husband. Not working well with her husband. So I said, well, what's happened? What's going on? And she said that she had had a foot injury and broke her foot at least 6 months ago, and that she never took care of it. So actually what I did was that together we worked on helping her foot to be more flexible, for her to be able to walk better, for her to be able to use her muscles better. Never even touched her pelvic floor. Wow. And all things were now working well with Boo Boo.
That's great. So one of the things that we did some work on together was even a further subspecialty within the pelvic rehabilitation. And why don't you kind of walk us into that space?
So the LGBTQ community is really at risk for all different kinds of healthcare. Many people don't want to go to their provider because they think they will be judged. They think that they will be dissed, that they will not be heard or understood, or asked to do things that are really not comfortable for them and not part of who they are and how they want to be. We know that from all of the literature. So in having the LGBTQ community, and also people who are asexual and also intersex, have those kind of issues of reluctance to go to healthcare providers, we've made it a mission of ours to really train physical therapists to know how to talk and treat transgender folk and the community all around, to treat people who have not had sex yet but are very anxious. I mean, here we have 172 universities and colleges. We have more 19-year-olds than live on the rest of the planet. And people are now coming and they are experimenting with their gender, with who they are, with hooking up and who they want to be involved with. And they're terrified that they don't have any instruction. So I think that we've now trained at least 160 physical therapists through courses that we've given in Boston, in Chicago, San Francisco, which you were a part of, and just recently in New York City, and it was Pride. So after we broke for lunch, everybody went out into the Pride parade and could see all of the potential participants that they would have in their clinics from there on.
One of the things that we talked about also that I learned in the course is that, well, let me back it up and put it this way. I kind of thought the only patients that we'd be really focusing on, that you would be teaching about, would be people who had major pelvic reconstructive surgery. And this was really serious reconstruction. But what I understood is that there are a lot of people, for example, trans men who bind themselves so that, and binding their breasts can cause all kinds of other orthopedic problems for them. And all of these things, so that anything that you do to change your body around for emotional reasons, for all kinds of reasons, can also really have long-standing impact on your functioning.
That's right. So there are many people who are trans male, what they would call themselves as trans male. And so having their breasts really so visible is really very different from how they think about themselves. So in order to feel more safe, they are binding themselves, and then they can present who they are to the world and feel better about that. If you bind yourself with an ace bandage, you bind yourself with some of the compression garments, you can't breathe as well. You are not able to really get as much oxygen into your body. Your ribs are restricted. 130 136 joints in your thorax, going from your neck to your waist, have to move with every breath. And so if those are really constricted and restricted, it's truly going to make it so that a person is not functioning as well as they possibly could. For others that are noticing that they then go on to have some top surgeries, then they have scars. And so again, scars take about 2 years to heal, can be very adhesive to a lot of the tissues and the structures around them. And so again, people can have neck and headaches, they can have shoulder ailments and not be able to reach up all the way, and then they certainly can't breathe. So just by going and having a couple of sessions in order to release it, learn what to do yourself, get your ribs moving, get your joints moving, can really be life-altering.
So one of the things that I found so interesting was, and now my thought has left my head. So, but what was I going to say? Oh, how much the physical therapists in the course wanted to talk about language and wanted to talk about how to speak respectfully with patients. And we spent a lot of time on that. I thought that would be like, let's get right in, let's talk about the pelvic floor. But do you want to talk a little bit about that?
Sure. There are at least 50 different terms to be able to express what your gender identity is, how you think about yourself, how you feel emotionally about yourself, what your thought process is in terms of who you are. So typically in our society, in the Western societies, not so much in terms of Polynesian societies and a lot of other societies around the world, Native American and elsewhere, that we think of either a boy or a girl. And that is very narrow in terms of how we can think about it. So having your sex identity at birth, and then your gender identity, who you think that you are and how you perceive of yourself, can be very, very different for people. And so if you now have changed your name, if you are thinking of yourself, let's say for you, transitioning to a trans male, you want to think of yourself as he and him, and you go into the gynecologist's office because you still may have your uterus, you still may have your ovaries and your fallopian tubes, and have them shout out, Judy Perlman, it's devastating. Right. Because that's really not who you are to the world. And the same for trans female and all of those aspects. So yes, being respectful of people, understanding where they're coming from, how they want to be addressed, all of those things are important.
And I think one of the things I took away from the training that I was in was the intersection between those very important identity issues, how I see myself, how I want the world to see me, and the issues of bowel, bladder, and sexual function. So you have a lot bound up in all of those issues when you are, and especially if you're someone who has received any kind of ill treatment from people in the world.
Oh, just not even ill treatment. You know that you went over a friend's house and you had a urinary accident, or you had a urinary accident in the shopping center, and you're never going to want to go out there again. Yeah. So it doesn't even have to be for the LGBTQAI community. Right. It's really for all people, giving them the respect and listening to their story. So many people come to me and say that they were given short periods of time. They felt like the person said, oh no, you can't have that. You know, either talking about burning and prickling or discomfort with penetrative sex, or some sort of issue with constipation or diarrhea, any of those various things that are so primary to our existence, and have somebody say, oh no, you can't have that because all of your tests came out, normal. And for who knows a person better than themselves. Yeah. So really being able to make sense. And that's what's so wonderful about you, is the fact that just knowing you and also working with you, you're able to take information and really figure out the story. So you listen incredibly well. You make sense out of things, and I think of you as an honorary PT.
Well, this is Meet the Problem Solvers. Thank you very much for those lovely words, Holly.
Yes.
I think this is going to be a very interesting journey for all of us. It's so wonderful to have Holly come in and inaugurate this, really laying out a problem, really laying out solutions, and also really empowering each of us to help our own selves, to help people in our families and our world by normalizing that these are issues that everyone has. Yeah, normalizing that you may have some challenges.
You are not alone.
You are not alone.
It's not your fault. You didn't do
Right.
anything. I have patients who have difficulty with penetrative sex. And I can see that they are blaming themselves. They think, I shouldn't have had sex in the Mustang when I was 17 years old. And I say to them, what a great thing. It's a great car. It really has class. And how wonderful that you followed what you wanted to do, as long as it was safe, as long as it felt good, as long as you were not coerced, as long as it was under your conditions. Then I think that you really need to embrace that as part of who you are, and that your body knows what you want, and that also you can ask for it.
And physical therapists are thoughtful, caring, humorous, really smart people. So, Holly, thank you so much.
It's terrific to have come here. Thank you very much.
And next week we're going to have a very different kind of conversation. My guest next week is Dave Christopoulos. He's the executive director of Hilltown Community Development Corporation in Western Mass. And he is a super smart guy who is going to talk about sort of the complex, multivaried issues of rural economies in Massachusetts. So thank you so much for joining us on this first one. Thank you, Holly. It was really fun.
Yes.
And we will really look forward to picking this back up next week.